Diseases of the GU, or gastrourinary system, and cranium don't exactly go together, but we do only have 1 week left, so I combined them. On page 542 in your Bontrager text, there's a list of pathology terms of the urinary system. Some of these terms you might have heard of before, and some you may not. I would like you to familiarize yourselves with those terms so that you could maybe understand them on a test, maybe not identify them on a radiograph, but match their term with the description. GU pathologies include such things as benign BPH, common in men as they get older, maybe in their 50s, where the prostate gland enlarges and presses on the bladder, causing some issues for them, such as pain or frequent urination. This can be diagnosed through an IVU or an MRI, or possibly an ultrasound as well. And there are also bladder calculi, which are stones in the bladder. You may have more than one ureter on a side. A kidney falls, which is an ectopic kidney, horseshoe kidney, or malrotation. There are a few images for you to view on these pathologies on the next couple of slides. An inflammation of the bladder is called cystitis. This can be seen on an ultrasound as well as an IVU. Glomerulonephritis is an inflammation of the glomeruli within the kidney. It would be a smaller sized kidney on an ultrasound if it was a chronic case, or an enlarged kidney on an IVU if it was an acute case. Polycystic kidney disease means many cysts scattered through one or both kidneys, often causes an enlargement of the kidneys. Kidney stones, those are very common. You can also have cancer of the kidneys. There's a couple images there for you. The top image is an ultrasound, and the bottom image is an image of a CT scan. Hydronephrosis is seen on an IVU. You can see a dilation of the ureters and how large the calyces look in the renal pelvis on an IVU. Pyelonephritis is an inflammation of the kidney and renal pelvis. This is caused by a pus-forming bacteria. It's different from glomerulonephritis in that it involves the tissue between the tubules instead of the glomeruli itself. If there's an increase in blood pressure to the kidney due to maybe atherosclerosis, severe hypertension can result in the death of a kidney tissue called necrosis. And that's not a good thing. And we also have to alter our IVU routine when this happens because the kidney can't take the pressure of the injection of the contrast media, so it's important to know if the patient has renal hypertension and understand the ramifications if we were to inject the patient. We don't want to slam someone into renal failure. We would have to alter our routine for that. Often, if there's a stone or something, or maybe a tumor blocking a kidney, there's an obstruction of urine flow from the kidney to the bladder. This can be seen on a radiograph as well. You can also have something called a fistula that could go from the bladder to maybe the bowel or from the bladder to the umbilical area. I've seen both. And this is just an abnormal opening between two different things, so you can actually have urine coming out of your belly button. And if it was a fistula going from the bladder to the belly button, that's what would happen. Or you could have feces going back and forth between the bowel and the bladder, causing a recurrent bladder infection, because feces in the bladder would not be a good thing. The bladder is sterile contents, so you would have to get this corrected because fistulas are abnormal and you don't want to have infections over and over again. And then this concludes the urinary system portion.